Welcome back to another Dynamic Joints podcast. This episode is all about how to keep you healthy as you age. So remember to like, share, subscribe, and hit that notification bell. And stay tuned to the end for our dynamic roulette, where you'll get a healthy tip from your physical therapist.
Tuning in to another Dynamic Joints podcast. It is your one and only, your favorite physical therapist, the world-renowned one. I'm always going to say that because I need to remind you, even though you already know, haters always going to hate, so it's always good to remind those as well. Best friend and business partner. Yes, your Woo-Sa. Are you Woo-Sa?
Woo-Sa. Yes, I am Dynamics Duos PT and OT. I am Dr. Angie, the occupational and physical therapist of this lovely establishment and the knowledgeable one that brings you the education you need on Dynamic Joints podcast. See how I did that? I brought it all back together and left it on the table.
And all about you. You left it all about you.
Okay. World renowned therapist.
Glad you know it. All right, so today's topic is about healthy habits for aging gracefully. Not my problem.
Yes, everyone can't be 25 like myself, and so for people that are aging like Dr. Tyre, we're going to give you some very good aging tips, because what are most people afraid of when they get older? Falling. And I'm going to help you prevent that.
That was a good one. You're going to get another bruise on your other arms. Okay. I think this is a really good topic because everyone can benefit from this.
Yes.
From the youngest to the oldest.
Right. From the athletic to the non-athletic.
Right. And I think that just having some forms of tools that you can have for you can help you determine where you are on the life of balance or the scale of balance.
Right.
Or stay balanced.
So I need you people to kind of like take that, just like we do ops and JIT and like jive me, whatever key term you use.
A 25-year-old uses
I saw that on this show called Shaft or something. I don't know. It was like in black and white, I think. You should know.
No, because I'm young.
Okay. So whatever the case may be, use balance because we need it in life, right? Not only physically, but mentally, work versus personal. Everybody should be balanced. Just like that.
Okay. So going to what we do as physical therapists.
Yes, tell the people.
So here at Dynamic Duo, we do a couple of assessments that just see where you are on the world of balance or in the world of balance, right? Because even though you are an athlete, you may think that you have really good balance, or vice versa.
Right.
If you are of older age, you may think your balance may be poor, and that may not even be the case.
Right.
So there are some things that we do here, such as, and you mentioned in the other episode, trying to get used to doing that. But you were talking about the chair rise test and all of that, right?
Yes.
How many times a person can stand up and sit down correctly and with control in 30 seconds. That tells us how well you're balanced, and it also lets us know about your muscle endurance and your lower extremities, right? Your lower legs, or your legs in general. Another thing that we do is your berg balance. And that's just different ways of how to challenge your balance in various positions. And what does your body do when your balance is challenged? Does it go with the flow, or does it try to stay up and maintain your standing posture, right?
Right. I think a lot of times people, especially as we are aging, our body has learned compensations and techniques of ways to allow us to do what we want to do without doing it the right way. For instance, as a younger person would stand up from the floor or get up from a chair, they don't position their feet in a certain position. They just stand right on up. That's me, right? I'm that person. However,
Demonstrate.
no, Dr. Tyre, on the other hand, is getting older. And it's nothing wrong with that. It is a blessing beyond blessing. And I too hope to be her age one day. Right?
That will be next year.
So,
next year.
So what I'm trying to establish here is a series, Tyre. You're interrupting that. So as Tyre would probably stand up, she's going to spread her legs a little bit further. And it's because when she goes to stand up, she's going to need more assistance to balance herself. Whereas I, the 25-year-old,
in your mind,
my feet are going to be planted. I don't have to think about where they are. I'm just going to bounce up. I probably can stand up on one leg.
Okay, those are all lies. Now, if you wanna say anything, tell our listeners how you sit down. What sound comes out your mouth?
I'm not sure because I'm sitting down. But
as you're coming to sit down, what sound comes out your mouth?
I don't know, like, ooh.
Or is it like a, yeah?
Those are sounds of aging gracefully.
Oh, is it?
I should make a CD. I think that's what you guys had. A CD.
No, you had Walkmans. Okay.
Back to what I want to let people know. It's a beautiful thing to get older. We just want your body and your mind to be connected. Because sometimes our mind tells us we're still really young.
Yes,
and
like
our body
yours.
is like, nope. Well, my body, I'm skating.
And I'm glad you brought that up.
And when I fall, I get back up.
Okay, so
Sometimes I gotta sit for a little bit. But
there you go.
I get back up.
There it is. You tell our
I'm trying to
friends.
tell the people on how to get age gracefully,
Right.
okay?
But you open up this can of worms. Tell our friends what happened to you the other day
I learned how to turn backwards.
while you were skating. And did you lose your balance?
That's neither here nor there.
And did you sit on the ground for a little bit to collect yourself?
I can't recall.
Because you are of older age,
Nothing was broken.
but you were sore
So
later that day into the next
going
day.
into breaking bones, osteoporosis is really, really important, right? Bone density. Because if you do fall, you're more likely to break a bone as you get older.
Mhm.
Now, this is not to scare the people, and this is not only for older people. Us younger people,
Like you, because you're 25.
as I wave to myself,
Okay.
have to be mindful of that because we are getting older and our bones do not heal as quickly as they used to. Our muscles don't bounce back when we hurt them, right, as quickly as they used to. So me being 25 and working with a 6-year-old, our bodies are going to respond differently.
Absolutely.
Same concept for the 25-year-old and the 62-year-old. Right? The bones in the body are going to respond differently. But that's okay because, again, we have more tips for you. So Dr. Tyre mentioned about standing and sitting from a chair. She mentioned about this Berg assessment that we do.
Cut. Because you're not going to see her again following these episodes. Okay? All right, go ahead. Since it's your last episode.
You gotta say, if you say cut, you gotta say action.
And action.
So what you want to be aware of, standing on one leg, when you change position of your feet, we always go back to the DUI test, right? When I don't know about it, I saw it on Cops.
Mm-hmm.
You saw that show?
Yep, I saw it in Reno.
Okay.
911. Step, hip.
Yes. So ironically, stepping in front heel to toe is a very challenging balance.
It is.
And not only just going forward, but going backwards. So when you challenge your balance, that's where you get to see kind of your deficits. But as therapists, our job is to prevent you from getting to that point of fear of falling or injuring yourself. So we like to give tips on how to prevent that.
And even fear of challenging yourself.
Yes.
Because I think once we live in a world of fear within our own bubble, it limits us.
Yes.
And we don't understand how that negatively impacts our body and our movement pattern. Another thing that you can challenge your body, your balance, is standing on a pillow or a soft kind of a cushion.
Right.
Because now your muscles have to work twice as hard to figure out, okay, what's happening, what we're doing, how we're going to maintain this standing balance, without injuring ourselves or overworking ourselves.
Correct. And I think that's with balance. Let's just talk about in life in general. Because as we get older, we retire. I'm sure you're close to that age where you want to retire, right?
I'm about to take your kneecaps out.
That means that you're going to
Snatch
move
'em
less.
out of your legs.
Right? When you move,
You won't be able to walk.
When you move less, I'm
Sit like this.
I'm
You're going to sit stiff legs. Is that what you want?
When you move less muscle is working, muscles are going to get weak, your endurance is going to go down because you're not doing as much. It's natural. Your life was really, really busy when you were my age. You were going out, you were enjoying friends, you were going to school, you go to work, you go and volunteer at, the senior citizen community. You're helping out, you're doing more. But as you get older and you retire and your friend circle, they're still working, or they may retire and they want to travel, or they want to go and do a garden, I don't know. Everybody starts moving more. And they're like, oh no, I exercise every day. What do? You walk to the kitchen, you walk to the bathroom. Your body is now getting weaker.
Walking is actually a good activity, but being consistent with it is going to make it even better. So that 30-minute walk a day is really good. Now, that doesn't mean that you're doing a strengthening component. That's just meaning that you are working on your endurance.
Right.
And I think a lot of people get that mixed up with, I'm walking, so that's my exercise for the day.
Right.
Versus being more specific and doing balance activities or strength activities, and then in addition to walking will make everything come together. It's like a exercise sandwich, if you will.
Yes.
Because I'm hungry.
Yes, you're always hungry. But also being aware that most people strengthen the muscles that they can see. So making sure that you're strengthening all muscles and not just the showy muscles, which most people do. So biceps, their shoulders, things that are going to show. So when people say don't skip leg day, they really mean it, right? You want to make sure, don't be this old buff guy with these old chicken little legs, right? And then vice versa, women, right? We're all like, oh, I don't want to be all buff. But lifting 5, 8, 10 pounds is not going to make you buff that you look like you're in a body weight competition. But it's going to keep things stable, because that's usually when we have our problem. And it helps us maintain muscle strength so that when it comes time for picking things up, moving things around, that you're capable of doing it without hurting yourself.
And it also helps create that leaner look. So wanting to stay healthy, move healthy, and look healthy, doing weight training is actually good if it's if you're able to do it in a safe manner. Balance training would be good. Strength training, again, that's go hand in hand with weight, and then your walking component, things of that nature. I think having a good regimen of exercises in your toolbox is going to help you age gracefully. Your body is going to thank you, right? Because we have a couple of 90-something-year-olds. So our oldest patient is 97. She just turned 97.
And she likes to dance.
Yes, she does.
Play bingo and talk trash about all of her neighbors.
She sure does. And the thing about it is because she's exercising, right? And you have her step up, step down, standing on like a squishy foam pad. And
she may not like it, but she appreciates it when she can go home. And she lives alone.
Right.
So she has to be able to move. And I think that's what's missing in therapy, right? Sometimes you get into these therapy clinics and the client's like, I just want to walk better. Okay, but there's so many other components that you need. If something drops and you live alone, who's going to bend down and pick it up? Well, you're under my care, so I want to make sure you're capable of doing it. And if not, well, this is how you should do it. Let's get your body moving in these motions so that when it happens, you know what to do. So I think that's really good to point out that all ages can still age gracefully.
Absolutely.
Because she only hangs on to somebody to walk because she's afraid to fall. So my job is to make her walk without holding on to anything.
Absolutely. And then you also have, on the flip side, a 12-year-old who had, was it an ankle injury or a knee injury or a foot injury, but he's a soccer player, right? And so, yes, he's a little bit more agile and a little bit more quicker than your 97, but you're still showing him some balance techniques and balance exercises that's going to help him further along his soccer career because he wants to become a professional, right? And so just knowing that the same exercises that he can do, your 97 can do with some modification
Correct.
for safety things. And I think the thing about it is people just dismiss one thing over the other because an age is a big factor,
Right.
but not understanding just because you're just as young as I am or just as old as she
Don't
is.
try to flip
I
this
did.
switch.
I
People
flipped it.
know.
I
Yeah,
flipped
I'm
it.
25, you're
You may
60.
look 25, but should I tell them your real age?
Let's keep. Hey.
Okay, because you just had a birthday. All right, and you right at that heel.
What I'm saying is,
all right.
not only do we care about physically being able to move and things, but you also have to worry about what you're ingesting and hydration, because a lot of people don't drink enough water.
Yeah.
And when you don't drink enough water, you get dehydrated. But not only do you get dehydrated, your bowel system can't do what it needs to do. Move things along, so people are more constipated. People's blood pressures are higher because their heart is having to push this thicker blood through the whole body. So that these little tips that we're giving you mean a whole other thing when it comes to the whole body coming together.
And not knowing that your body is made up between 70 and 80% of water. So your body needs that to function for your organs, for your muscles, and for your blood, right?
Yes.
And so having a hydration, i.e. drinking water, drinking water.
Yes.
Okay.
And not no sweet tea
or iced tea.
Diet Coke
or Diet Pepsi.
None of that fuzzy tonic stuff. You want just regular water.
Because that's how your body can manage and function with just regular water. So staying hydrated is very, very key.
Yes.
Because like you said, it just helps with the whole gamut of things within your body system.
Right.
And another thing too, right, and what we eat. So we're not nutritionists. So
not at all.
We can't give you all the ins and outs of details of being very intricate in meal planning and things of that nature, but we can talk about what we have done to help maintain a healthy diet and healthy living.
Right, and it's not necessarily what we have done, because some of us don't eat as healthy as the other one. We'll go there on another day. But
I like cookies. I'm not gonna lie.
Listen,
I like cakes.
Cookies is not the option for dinner.
I like
It should
pastries.
not be the option for
I
lunch.
like candy.
You do. Now, what I'm trying to say is that as we are so busy in our day-to-day life, remember 25, I got a lot of stuff going on. 62, she doesn't have a lot of stuff going on, but she doesn't have the family to
You
feed.
are about to get got.
She doesn't have the whole family to feed anymore, right? So convenience is usually a thing. With prices going skyrocket with groceries and we don't know what is to come of this, we have to be aware that processed foods, stuff that lasts in the freezer for years and months, has so much sodium. So me looking for the convenience factor, I have to be mindful that I can't eat a lot of frozen dinners. I cannot go out to fast food restaurants and eat a lot of that because it's filled with sodium. Sodium is going to increase your blood pressure. And if you're not drinking water, you're going to be dehydrated and with high blood pressure. But you also have to remember the person that doesn't get a lot of options for fresh food because they're not getting out as much, it's going to go to the frozen foods as well. They're easy. I don't have to worry about it. I pick out one that I want to eat. Soup. A lot of older people don't have huge appetites, so they go to soup. Soup is full of sodium, if it's especially canned soups, right? So you have to be mindful and educate that your blood pressure is high, not because you're not doing something right. It's because you're eating too much of this. So while we're not dietitian and nutritionists, we do know how to read the back of the labels on these nutrition labels, rather. We're being mindful of what we put in our body, because what we put in determines how our body runs and if it's going to allow us to be healthy and age gracefully, like myself of 25 years.
And then another good tip as far as aging gracefully is adequate sleep. I think because we're in a world of hustle and bustle that we're always on the go, and we don't give our bodies chance to just stop, calm itself down and relax.
Right.
And because of that, and always being in this rat race that we aren't sleeping like we're supposed to. And in order for your body to function accordingly, at least 6 hours
Right.
is the recommended.
It's a
at least.
consistent 6 hours.
Exactly.
Don't be like me that wakes up just to see what time it is and then go back to bed, right? I don't know why I do it. Don't ask. Don't
Yeah.
send me any messages. I'm just saying that's what I do. And so my consistent sleep isn't as good as it could be because I need to know what time it is.
Yeah, you're weird.
I
So,
could be.
so just again, movement,
Yes, please move.
nutrition,
Eat well.
hydration,
Drink water.
and sleep are the 4 main tips of aging gracefully.
Yes.
As you can see, with her being 25
Yes.
and I being 26 and a half.
Okay.
Okay. All right.
Nice
So
way to spin that.
it is time for our dynamic roulette.
Yes, so
Let's
I'm
go
gonna reach
ahead
on
and-
in. Remember, these are just tips. They're not recommended for everybody, and they're not strongly suggested for anybody. It's just what we have to offer you, kind people out there, for listening. The role of OT in hand and finger rehab.
How crazy is that?
Because I am the OT in the bunch.
Yes.
So, a lot of people always think that physical therapy is just the go-to end-all be-all, right? But there's the sister part, which we've talked about before,
Ding.
that you can go to occupational therapy, which works specifically strongly in hands because it's a fine motor task. Fine motor, very precise. Our job is to get you being able to use that. There's a lot of stuff that goes in the hands in a very small space. So OT is really, really good at making sure everything moves as well as it could be. We have stories galore about OTs, but definitely if you're having any type of hand arthritis, if you have rheumatoid arthritis, if you broke a finger, if you're a boxer and you have a fracture, if you've fallen and you pushed on your arm wrong and you broke your wrist, go and see an OT. They will fix you up.
And if you were working and got a cut or had to have any kind of surgery,
Yes.
right? So those are some other things that
Trigger
you can
finger,
go,
Dupuytren's, you name it, we can fix it if it's on the hands. Now, don't get me wrong, there are physical therapists that are actually special in hand therapy as well, but it seems to be a stronger component in the occupational world. So, if you need us, call us, we're here for you.
So thank you for tuning in to another episode. I'ma close this out because I always do, because I am the dynamic one.